You're watching Medical News Network.
I can see why you chose Dr. Stout. He was obviously very focused on doing a good job at what he does and learning, and he's also a very personable young man. I also want to ask you a question. You said that sometimes there's a concern with the ones that just do
mandibular advancement. That's the basis for most sleep apnea appliances. They pull the jaw forward. But there's a point where if you start pulling it too far forward, you're putting too much stress on the muscles. And then the muscles go into spasm and they cause TMD type symptoms, or the patient has pain basically.
Okay, take me into this all on four, because when I last talked to you a few years ago, you were doing stuff with traditional implants that a lot of people weren't doing, which is why I came and talked to you. Tell me how this works and why this is what is the newest, best thing in dental implants.
Well, the key to this is we're putting in 4 implants, but we're putting in implants in the posterior or the back of the mouth that are tilted. And by tilting them, we can avoid going into the sinus. If we tilt them on the bottom, you have a nerve that runs down the whole mandible.
Right, I know that.
We avoid going into that nerve by tilting him.
Because there are people that have had that nerve get hit and causes numbness in their face.
It'll cause numbness in their lip, right,
yeah,
in their
forever.
face, yes.
Right.
So you want to stay out of the nerve, and if
so you avoid even getting anywhere near that nerve.
Exactly,
okay.
by tilting these appliances. And by tilting them, we're getting more what we call arch length. And by getting more arch length, because we're going further back in the mouth, we can support all the teeth on this one prosthesis.
And now you're telling me you only need 4.
Exactly.
So theoretically, it's got to save a considerable amount in expense.
Oh, the expense is half the cost of what we used to charge for conventional. Plus, we don't do the grafting, so it's even more than half the
And
cost.
you don't do the sinus lifts.
Right.
Okay, well, let's have a look. No, we have the patient. He's here, Devo. Tell me a little bit about what all M4 brought to this, what was going on, and is this something you normally see?
Yes, this is something that we see quite often, actually. What we were trying to do was trying to keep what he had as long as we could. But it just sort of came to the point where he's having too many infections, breaking teeth. Things just weren't working anymore.
Well, by looking at the picture, you can see he's had a lot of dentistry done over the years. It looks like he has maybe an implant or something in the back. He's missing some teeth. He's got some gum recession.
Yes, he's had a lot of dentistry, but over the years, for whatever reasons, people, sometimes it starts to fail.
Are some people just predisposed to having dental issues?
Well, there's a lot of issues that affect it. Number one, it could be diet, nutrition, home care, medications people take. You know, some people are just more dry, where they're more prone to decay.
Okay, I'm going to ask him, because you are here.
Yeah.
Obviously, you took care of your teeth. I mean, you came to Dr. Was it frustrating?
Dr. G, I didn't take care of my teeth, is the truth. And about 25 years ago, when I started coming to them, then I did start taking care of them and being as good a patient as I could.
But you'd already hit a point where things were starting to break down.
Yes. Yes.
And it obviously had work. Okay, so tell me what you were able to do for him.
So what we said to Debo was, hey, we've come to a crossroads. We got to do something. And one of the options is just removing all the teeth. And if you remove all the teeth, you got to put something back in. And one of the things to put back in would be either a denture that's something removable, or we could place some implants and place a prosthesis in that does not come in and out. In other words, fixed bridges.
So do a lot of people, I mean, obviously to have all your teeth removed, I mean, is that something that some people just need to have done? Or because he's obviously been trying to save them, right?
Sometimes it's more practical to say, hey, let's start off, remove all the teeth, then we can rebuild it and rebuild it more correctly. If we're going to get there anyway, let's get there in a more efficient manner.
Did what you did for him, and you're going to show me what you did, is that pretty much ended his dentistry issues, so to speak?
Yes.
So he's done now?
He's done.
No more tooth decay?
No more tooth decay, no more toothaches, no more infections, no more swelling, no more gum problems. Yes, that's all done.
Okay, show me what you did for him.
Okay, this is an x-ray, and on the top x-ray we can see where he has the teeth in place.
And he's had a lot of dentistry done. There are a lot of root canals, I can see the white, and a lot of bridges and crowns.
Right, but things are starting to fail. So we went to the next option, which was removing the teeth. And on the same visit, what we did was we placed 4 implants on the top, and we placed 4 implants on the bottom. And then we put in a fixed prosthesis on both arches.
And this is again the all-on-4 where you
Right.
actually angle the implant so you don't have to do the sinus lift,
Right.
which in old-style traditional implants would be a surgery all in itself.
Yes.
And you're telling me you can load these, basically, your experience, you came in, you pulled all the teeth?
Yeah, and the reason we did it is I had constant abscesses all the time, and Dr. G's done heroics to save my teeth, as you can see, but the abscesses were poisoning me, and I was sick, my health issues over it, so I said it's time, we need to take them out, and I was thinking old school, got to stick it in my mouth and live with it every day, and Dr. G, through his expertise, did this.
And that's all on that implant?
Yeah.
With the
Yes.
singers.
Yes.
So tell me your experience. You showed up, what'd you go through?
Did everything in one day, so I don't remember that day, to be honest with you, because he does like anesthetize me, and
So you showed up
yeah,
with those teeth,
yeah,
went to sleep,
pulled everything out, put the implants in, put these on, and
and you woke up and had teeth.
yeah, yeah.
And since you've had them in, any problems, issues?
No.
He doesn't have to worry about any more of the breakage, any more of the...
No.
No, I'll never have another root canal.
You say that like it's something that...
I'm thrilled about that. 20 years and you saw what we did.
Are there people, I mean, and again, obviously in your case you had bone, but are there people that are beyond help by this? I mean, or can you help just about anywhere?
We have not come across anybody who we could not do this on. There's almost everybody is a candidate for this.
And the majority of them, just like Debo here, the majority of them show up, you do IV sedation dentistry.
Yes.
They go to sleep, they wake up, this is done.
One visit. We just do all the surgery, remove the teeth, place the implants, place the prosthesis in, patient walks out the door with teeth. The next one is Rocky. Now Rocky came to us with a unique circumstance.
I want to stop for just a second. Rocky's is here. Rocky, you wouldn't even let them take a before picture of you, is that correct?
That's correct.
We went to look for that and there wasn't one, and you said it was just because...
I was too embarrassed.
When you don't smile, people perceive it. They perceive it's a personality thing. Do you find that?
Yeah, they tend to think of what's wrong with me, what's wrong with this guy.
Why ain't he smiling?
I had a picture taken shortly before I came to Dr. Gonzalez. My wife and I had gone to Death Valley. And I asked someone to take a picture of us. And when I got home and looked at the picture and I saw one tooth in front, I was so embarrassed that person even saw it. I deleted the picture.
Is that something you see a lot? I mean, is that...
Definitely.
So now this is Rocky's X-ray.
Right. This is Rocky's
But
X-ray.
now he shows roots up here, right? These aren't teeth?
He had a lot of roots. A lot of the teeth were broken off right at the gum line. That doesn't mean you can see them.
Wasn't that painful, Rocky, to have your teeth?
It was, I experienced severe pain over the years.
Were you just that afraid of the dentist?
Absolutely. I was scared to death. I hadn't been to a dentist since 1974.
And I'm going to assume that you have the same experience most everybody else has here. You probably can't tell me anything about your surgery or what he did.
No, I can't recall anything.
You came in,
coming in, and
went to sleep, and went home with a beautiful smile now.
Yes, I did.
All right, tell me this. So Rocky had roots.
Right. He had roots. He had plenty of bone underneath those roots. And that's what we were looking for. The object here is to remove the teeth, place implants, and put something in there. And we didn't want to do any grafting. And so that's what we were able to accomplish with Rocky. And as you can see on the X-ray, we took out all the upper teeth. We didn't place implants on the upper. We placed the a removable denture on the upper. The bottom is the one where we placed the implants. So he has the implants in place, and he walked out of here, and that was fixed in place. It's screwed in.
Give me your experience. You came in, you got your teeth.
Because I was so afraid of dentistry, I knew I'd have to have a sedation dentist. So I started researching online, and Dr. Gonzalez's name kept coming up. And I read the reviews, I read about his experience. That made me feel like this man really knew what he was doing. So as I stood at the front door deciding whether I wanted to walk in or not, and I finally did, I was put at ease immediately, and by the staff here.
What is it that you remember going through here? Tell me about your surgery.
The surgery, I don't recall. I was given the little blue pill to relax me before I left home. My wife drove me here.
And your diet, has your diet changed? Are you able to eat foods now that you weren't able to eat before?
Oh, absolutely, absolutely. I had kind of a soft liquid diet before that, and now there's really nothing I can't eat.
Let's move on to the next one.
Okay, this is Randy. Randy's right there.
Randy's right here. Hi, Randy. I wanted to tell you, Randy. When I was sent your before and after pictures, full face pictures to look at, because I do look at the pictures before I come. I didn't believe you were the same person. I mean, you looked. I looked at those two pictures and thought, that can't be the same person. Does it make that big a difference in your life?
Yes, it does. It really does. I couldn't believe the difference. You know, people look at you totally different.
So tell me what you did with him. Now, obviously, he had some challenges. I mean, but he still had some teeth. So what went on here?
Well, what we did was he came in, we put him to sleep, we used the IV sedation, and then we...
Did you like that part too?
I didn't know a darn thing.
That's the typical reaction.
Yeah, I found that here.
They don't remember.
People don't say... But you know what? When it comes to getting stuff done, that's actually not a bad thing. So tell me through the problems he was having, the issues. Now, he looks like he's lost a little bone in the back.
Well, he has lost some bone in the back, but we're not going to be going back there to place the implants. We're going to be staying more in the forward area.
Because traditionally, you would open that up,
Right.
do bone grafting, take some bone from the hip or the chin or the jaw, or synthetic, and then sew that up, and he'd have to wait 4 or 6 months.
That's the traditional approach. You wait 4 to 6 months, then you re-enter again, place the implants, wait another 4 to 6 months, then you can start rebuilding it.
And all of that adds to, obviously, the expense of having it done.
Oh, definitely. It's
Okay.
more expensive that
So
way,
what did we do with him?
So what we did was we took everything out in one visit, and we placed the implants the same visit, and placed the fixed prosthesis again the same visit.
And I'm going to ask you, because I know he informed me he had a little bit of gum disease prior.
Oh yes, you can see right here there's a lot of gum irritation, infection in the gums. He had probably an abscess on that tooth, so we did it all the same day. Even though there's infection there, we just go in and clean it all out.
Okay, and I have to ask you again too, just like Rocky, your diet, was it being what you could eat or couldn't eat? Was that determined a lot by your ability to chew?
Yeah, I eat a lot of hamburger.
Yeah?
Pretty much ground up meat.
It's because it was easy to chew and you could get it down.
Yes.
And are you learning, just like Rocky was, to chew whatever you want again?
I pretty much can chew anything I want.
So take me through what All on 4 offers him.
So with the All-on-4, you can see from this implant, we sort of find out, identify where the sinus is, and then we place the implant in front of the sinus but at an angle. And so by placing it at an angle, we're further back in the arch. Again, we're gaining arch length, and therefore we can have more space to cover with our prosthesis.
And I do want to make one final point, because I did some research on this. I like to know, there are other people that do this.
Oh,
in
sure.
fact, there's a big, I call them clearinghouses. There's a big clearinghouse company that advertises themselves, and when you call them, they send you to 12 different people.
Right.
Everything is done. You guys didn't go anywhere but inside this building. Everything is done here.
Right, that's correct.
And in one visit. All right, well again, thank you for taking the time to talk to me. I look forward to the next time.
All right.
You've been watching Medical News Network. I'm Mike Wittgenstein. For any information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.